We talk a lot about supporting our veterans, but what happens when a veteran's in crisis, like really in crisis? What can we do then? And how do we make sure they're getting the right kind of help exactly when they need it? Well, that's what makes this duck dive so important because we're going beyond just talking about the problem.
Exactly. We're looking at what's actually working on the ground. Real programs, real solutions that are making a difference for veterans in crisis. And we're diving into this recent VA news article, Enhancing Access to Mental Health Care for Veterans in Crisis, to get into the nitty-gritty of two specific programs.
And what really caught my eye is these programs focus on what happens outside of a VA facility, right? Because
Yeah.
the VA does offer a lot of resources, but sometimes those aren't always easy to access when someone's in the middle of a crisis, especially if it's happening out in the community.
Yeah, absolutely. And it's a critical issue, right? Because in those moments when a veteran is in crisis, having the right kind of response can make all the difference.
Okay, so let's jump right into it. The first program we're looking at is the Veterans Mobile Evaluation Team, or VMET. And this stat from the article really hit me. VMET has responded to nearly 8,000 calls, but only a tiny fraction of those calls actually resulted in the veteran being involuntarily held. I mean, that's got to be significant.
It really is. It speaks to the heart of what VMET is all about, providing support and avoiding unnecessary hospitalization or, even worse, incarceration.
Because sadly, we do see that sometimes, right? Veterans ending up in situations that could have been avoided if the people responding, maybe law enforcement, if they had a better understanding of what they were dealing with.
Exactly. And that's where having a VA clinician embedded with local police can make such a difference. I mean, think about it. A veteran is in crisis, but instead of just a law enforcement response, you've got a trained mental health professional right there on site who can assess the situation, provide that immediate support, but most importantly, can connect them with the right resources.
It seems so common sense when you say it like that.
Right.
But I'm guessing it takes a lot of specialized training to make that work effectively.
Oh, absolutely. These clinicians, they go through intense training. They learn about the unique challenges that veterans face, things like, the invisible wounds, trauma-informed care, de-escalation techniques, but specifically tailored to veterans, and crisis intervention strategies that really put the veterans' well-being first and foremost.
So it's not just about responding to a mental health crisis, it's about responding to a veteran in crisis. That feels important to highlight.
It's huge. It's about understanding that experience, that background. And the article actually highlights some really impressive results. For example, the VMET team in Ohio responded to 165 calls, and only 6 of those resulted in involuntary hospitalization.
Wow.
And then you look at Oklahoma, 6 calls, 0 incarcerations.
That's incredible. That really speaks to, like you said, the importance of having that specialized training, that immediate access to mental health expertise.
Not just about the numbers, though. It's about, preserving dignity, building trust, and showing veterans that someone out there gets it, They get what they're going through.
And sometimes that understanding is even more powerful when it comes from a fellow veteran, which leads us to the second program we're going to look at. Veteran Response Teams, VRTs.
Yeah, and this is where that whole idea of veteran helping veteran really comes into play. So these VRTs are made up of law enforcement officers who are also veterans themselves, and they go through this specialized training to respond specifically to crises involving other veterans.
So you've got that inherent understanding, that shared experience that can be so important in building that rapport, that trust, especially in a crisis situation.
Right, exactly. It's like speaking the same language, understanding the nuances of military culture, and recognizing those invisible wounds that so many veterans carry.
It's like you instantly have that connection, that understanding that can be so crucial in de-escalating a situation. And there's actually a really powerful story in the article about this from Wilmington, Delaware.
Yeah, this one really stuck with me too. So there was a call, a veteran in crisis, and a veteran officer responded. And because he had that background, he was able to really connect with the veteran in a way that maybe someone else couldn't have. He de-escalated the situation, got the veteran connected with the help he needed. But what's really amazing is that the story didn't end there.
Right. The article talks about how those two veterans actually ended up forming a real bond. The officer kept in touch, continued to offer support, even years later.
That's exactly what I'm talking about, that VRT in action. It's about that long-term support, those connections that can have such a profound impact on veterans' recovery. It recognizes that sometimes the most effective kind of help comes from someone who's been there, who understands what it's like to walk in those shoes.
Absolutely. And speaking of making a difference, it was great to see that the article highlighted how both of these programs, VMET and VRT, they're being expanded to more locations. That's got to be a good sign, right?
It's huge. It shows that the VA is really committed to making this work, you know,
Yeah.
providing the training and resources for communities across the country to implement these programs, which is why I think this deep dive is so important right now, because it's not just about these two programs. It's about this larger shift that's happening in how we approach veteran mental health.
Yeah, it feels like we're moving beyond just raising awareness. We're actually seeing some real action.
Exactly. We're realizing that this issue needs a different approach, a more comprehensive one that involves everyone, the VA, law enforcement, mental health professionals, and I think most importantly, other veterans.
It's recognizing that one size doesn't fit all, that veterans have unique needs that need to be addressed in a way that makes sense for them. But as these programs expand, do you think there are challenges they might run into?
Oh, absolutely. There are always challenges. I think one of the biggest ones is going to be securing that long-term funding and support. And these programs, they require resources,
Right.
right? Training, staffing, ongoing support, and making sure that commitment remains over time. That's going to be key.
Because without that consistent support, it's hard to make a real impact, right?
And then beyond the funding, it's also about having the right people involved. Passionate people, clinicians who are dedicated to this work, veteran officers who are committed to helping their fellow veterans. Because without that human element, even the best program in the world won't be as effective.
Because ultimately it comes down to people connecting with people, right? Building those relationships, offering that support, and showing veterans that they're not alone.
Exactly. It's about recognizing that human connection, that shared experience.
Hmm.
And that's something that we can all be a part of.
And that goes beyond just writing a check, right? We have to shift that mindset, get rid of that stigma around mental health, especially in some of these veteran communities.
You're preaching to the choir. We need veterans to feel like they can get help without feeling like they're letting people down, or that it's weak or something.
It's actually the opposite. Asking for help is incredibly strong.
Couldn't agree more. The more we talk about it, the easier it becomes for veterans to reach out. And that's how we start to change the culture.
It all circles back to those human connections, doesn't it? Being there for the veterans in our lives, letting them know we've got their back.
Being a good battle buddy, right?
Yeah.
Sometimes all it takes is listening without judging, maybe giving a little encouragement, and reminding them that their service, what they did, it matters.
So as we wrap up this deep dive, the article really focused on the successes of these programs, and that's fantastic. But are there any potential challenges that we should be thinking about as these programs grow? And what can we do, I guess, more broadly to support their long-term success?
Man, you always know how to ask the tough questions. This one big thing is making sure these programs work for everyone, right? Every veteran is different. What works for one might not work for another. So we got to be flexible.
Yeah, you can't just have a one-size-fits-all approach when it comes to something like this.
Well, we're talking cultural sensitivity training, specialized support women, veterans, LGBTQ veterans. We've got to make sure everyone feels seen and heard.
It's easy to forget sometimes how diverse the veteran community really is.
Yeah. And, it's not just about the programs themselves. It's also about access. How are we reaching veterans in rural areas? How do we deal with language barriers? Homelessness. These are some of those challenges that keep me up at night.
It really highlights that this isn't a one-and-done situation. There's always going to be more to learn, more to do, more to figure out.
It's a marathon, not a sprint.
Right.
We have to keep evolving, keep adapting.
Just listening.
Exactly. And it's not just on the VA. This is a community effort. We all need to step up, create those support networks so that veterans know they're valued, respected, that people care.
It's about recognizing that their well-being is our well-being.
100%.
Well, this has been a fantastic deep dive, incredibly insightful. We've covered a lot of ground, learning about VMET and VRT, and really gotten a sense of the complexities of supporting our veterans in crisis.
And I think we've gone beyond just the what. We've dug into the why and the how. Why are these programs so important? How do they actually work? And how can we all contribute?
Because at the end of the day, this isn't about programs or statistics. It's about people's lives.
Absolutely. It's about honoring the service and sacrifice of our veterans, making sure they get the support and respect they deserve, not just when they're in crisis, but throughout their lives.
And with that, we'll leave you with this thought. What can your community do differently to support veterans? What are the unique challenges you see, and how can you be part of the solution? Think about it, and let's keep this conversation going.